sub-Q and IM test out. You're going to gather supplies. You need an injection pad. You need your medication. Your sub-Q medication is going to be mixing regular and NPH insulin, and so you need an insulin syringe. And there's two sizes. One goes up to 50 units, one goes up to 100 units. So depending on how much insulin you're giving, you would decide which one. Some places only have one size. Okay, and then I have my IM medication, which is penicillin, and my IM syringes could be a 3 ml or a 1 ml. And then if it's IM, the only needle would be the 22 gauge right here. And then you have alcohol pads, and then you have your gloves. So the first thing is I have my bar, and I'm checking to see what I need to give. And it's 0900, I have to give my patient a sliding scale insulin with the NPH, and the patient's due for a penicillin. So I'm in the med room, I've washed my hands, I don't need gloves until it's time to do my injection. Okay, and so I look at the patients, they're getting 34 units of NPH insulin, their blood sugar is 310, that means 6 units of regular insulin. So my first step is to gather my medication, and I have the NPH and the regular insulin here. I am doing my first check, making sure it's right. The right concentration is U100, U100. It's not expired. If it is, it goes back to pharmacy. Actually, this expired in 22, so I would have to pharmacy. And then my NPH is U100. Okay, and it expires in 24, so this one is good. Okay, insulin could be open for 28 days. Once it's open, you have to use a Sharpie and put today's date on it. So I did my first check. I know how much I'm drawing up. My next step is the NPH is the cloudy, and I have to roll it to mix it up. Not shake it. There'll be an NCLEX question. You don't shake the insulin, you roll it between your hands, and it mixes. That regular is clear, it doesn't have to be. I've checked expiration dates, it's the right concentration. I clean the top of the vials. And now I take my insulin syringe, take the cap off the back, and it goes cloudy, clear, clear, cloudy. Air goes into the vials first. I rainbow off when I take the cap off so I don't accidentally get poked. And we start by putting air into the cloudy. And my cloudy NPH says 34 units. So I draw back 34 units of cloudy and put air in. And then my regular is 6 units. I draw up 6 units and I inject that in here. I could have drawn up all the air and go shoot it in, shoot it in. Either way is fine. Once I shoot the air into the regular, I flip the vial and I stay here. And then we draw up the clear insulin, and I draw back to 6. And this is the time, if you have glasses or you can't see because it's so small, you want to wear it so you're accurate for the patient. I can draw even more extra up because nothing's mixed. 10, 8, 6 units, make sure there's no bubbles, rainbow off, and I have my clear insulin. We want to do it in this order because if you draw up the cloudy first and you accidentally inject cloudy into the clear, it's not good anymore. Okay, my NPH is 34 and I already drawn up 6, so I'm pulling back to 40 now. Nope. Okay, we don't want to inject anything. It was air, air, and now draw up the clear, and now 34 plus 6 is 40, so I draw back to 40. You can't draw more. If I accidentally went to 41 or 42, I have to toss it and I can't shoot it back in or I'm mixing it. And rainbow off. Okay, that's the needle. This is the barrel of the syringe, and this is the plunger. You only try to hold the tip of it. You don't want to hold it like this because what happens? Then it pushes inside, and now I've contaminated the inside. Okay, so I have my 40 units of insulin. You're not allowed to recap anymore, so we call it scoop capping. You carefully, without touching the tip of the needle anywhere, go like this, and now we can push the cap on, and then we label that this is the insulin. So my second check, it was 34 mph, it was 6 of the regular, and I lay that there. Now my next order is for penicillin. I have to do a math problem. It'll say it comes as 100,000 units, and I have to give, 50,000 units. So I did my math. I have to give 1 ml. So I'll do the same steps. I grab the med, penicillin G. Is it the right concentration? Is it expired? It is not expired, 2028. And I'm going to clean the top of that. And it's a 1/2 ml. I could use the TB really, but then I'd have to change the size of the needle because it's a sub-Q. So I'm just going to use a 3 ml syringe. And I have to put the needle on. This is the sterile part. We open, and sterile to sterile, twist it on tight. If you don't twist it on tight, it'll leak out all around there and you're losing medication. I rainbow off. I draw back to 1/2 ml. And again, I inject my ear first, and then I flip the vial and I pull back to 0.5, making sure there's no air. Rainbow off, flick out any bubbles I see, and then I scoop cap it and I label that this is my penicillin. Okay? I've drawn up both medications. Now I go to the patient's room. This is a 20-minute test out. Okay? I go to the patient's room, knock on the door. I'm Lisa. I'm here to give you your medication. What is your name and date of birth? And she says Caroline Brown, 5/1951. Any allergies? She says none. I have your penicillin for you. Where would you like it? It goes into a muscle. And she says, I want it in my hip. So I put the gloves on. So any order for this. And I'm going to clean the site. She wants it in her hip. Okay? So I clean the site. Good. It says clean the site for 30 seconds. Let it air dry. We never wave it or fan it. I rainbow off. And this is an IM, so I spread the skin. And I'm going to go at 90 degrees. I dart it in. You're going to feel a pinch, dart, and then finger lifts up to inject the med, rainbow off, and into the sharps. Okay, if there's a drop of blood, I could use a little, never alcohol, it's going to hurt. So I could use a little dressing. Okay, and now I have your insulin. Where would you like it? And she says my abdomen. So I get a new alcohol pad. I clean the abdomen, and this time it's a pinch. Rainbow off. I pinch the skin. You're going to feel a pinch, 45 to 90 degree angle. Finger like this. Okay, rainbow off. Put it in the sharps. One thing students like to do is they like to be ready. Okay, I'm going to give you your injection. You don't walk around with your finger out here because you could squirt some medication out. Hold it like a pencil. Here we go. In, finger, out, into the sharps. Okay, make sure there's not any bleeding. And now I'm ready to sign off my medications here.